The following is a paid advertising program. In this fast-paced world of television, 30 seconds is not a whole lot of time to tell the world about your business. We're giving more time right here on Arkansas Showcase. Welcome to Arkansas Showcase. My name is Tracy Douglas. This morning we are talking with Arkansas Specialty Orthopaedics. Jimmy Tucker and Eric Gordon are both doctors there. And the website is arspecialty.com. There it is up on the screen, 663-3646. We urge you to give them a call. The website. This morning we are going to talk about, first of all, something called fellowship training, and I think this is so hugely important, and if you get nothing else out of this couple of minutes, you need to listen up, because this is important when you're deciding on what doctors to pick for your operation. So Dr. Gordon, we're going to start with you, and you're going to tell us how important it is for people to get a doctor that is fellowship trained and what's involved in that.
Well, I think if you want a true specialist in whatever your problem is, you need to see a fellowship-trained surgeon. And basically what that means is that fellowship training is just extra training. I mean, to be an orthopedic surgeon, you have to go to 9 years of school after college. And I mean, that's a lot of school, but fellowship training is even more. And that's what sets our group apart, is that all the surgeons in our group are fellowship trained. Everybody does their normal training. And when you're done, you know how to take care of shoulders, elbows, knees, and hips. But it's hard to know everything about everything. And so what ends up happening is, without a real focus, people just kind of know a little bit about each little different part. Fellowship training is that extra year of training where you go and you really focus on one particular topic. For example, Dr. Tucker and I both did fellowship training in sports medicine. So we just treat shoulder and knee injuries for the most part. Other surgeons in our group just do joint replacements. I don't do joint replacements because there's guys in my group that do that, and that's all they do. And frankly, they do it better than me. I'm not too proud to say that. And so if I was going to send my mom to get a knee or hip replacement done, I wouldn't do it myself. I wouldn't let Dr. Tucker do it. I'd send her to a fellowship-trained surgeon who has that extra specialization.
Do you have doctors in your group that can cover everything? I mean, there's
Yes.
some specialty for every problem that somebody may have.
Now, our group has more fellowship-trained orthopedic surgeons than any other group in the state, including even the university setting. And we have fellowship-trained surgeons in spine, hand, sports medicine, shoulder, hip and knee replacement, foot and ankle. You name the limb or the part of the body, we have a specialist that covers it.
And so they wouldn't have to go anywhere else because you don't handle it at your organization. Okay. Name some of the most common injuries, Dr. Tucker, that you guys see.
Well, one of the things we see a lot are knee injuries, and particularly in athletes. Everyone knows about the anterior cruciate ligament injuries because that's the one that the football players and basketball players get. So it gets a lot of press. So we see a lot of anterior cruciate ligament tears, or ACL tears as they're called. And
you see obviously men and women, probably more men.
More men, but it's pretty close. There's more men participating in sports, but actually the ACL rate's higher in, the tear rate's higher in women than it is in men. Because of some differences in their anatomy, and there's some hormonal differences, and just the way men and women tend to jump are different. And so women are very dependent on their ligaments, and so it puts extra stress on them and can lead to ACL tears.
So ACL tear is very common.
It's a very common injury.
And so, all right, so what do you guys do about it? What's the latest in treatment for that?
Well, when the ACL tears, it explodes, and so you have to make a new ACL, and there are different types of materials. Basically, there are 3 different types of materials that you use to make a new ACL. Part of the kneecap tendon, or part of the hamstring tendon from the patient themselves, or something called an allograft, which comes from a donor. And we try and demand match, so there are uses for all 3 of the different grafts. And in competitive athletes, we tend to use their own tendons because they hold up better. So we use the patella tendon and the hamstrings more in competitive athletes and younger patients. And then as you get older, the stress is less, and so we tend to use more allografts.
All right. Any advice you can give to people? How do we avoid getting those common injuries? I mean, is there anything we can do? It's just kind of the nature of the game, isn't it?
That's part of it. There is some training for female athletes that decrease the amount of tears, and so there are some positive things that you can do. And just like snow skiing, you really need to be in shape before you go snow skiing. And so there are some positive effects that you can have on knee injuries.
I bet that's a common thing. You get people think that they can go out and snow ski. They haven't been in 15 years. And yeah, so you have to be very careful. All right. Again, the website is arspecialty.com, 663-3647. Make sure you get somebody that is fellowship trained, and all these guys are, so give them a call. Thank you, gentlemen, for being here. Thank you for being here. We'll see you next time on Arkansas Showcase. Take care and have a great day.